Hello, everyone. My name is Faven Ed. I am one of the jurors, and I have sided with the plaintiff. For the reason why I have sided with the plaintiff is that I believe that her privacy has been has been disrupted. Her HIPAA violation. I'm sorry. The hospital has violated HIPAA rules. HIPAA states that her medical information will not be given to anyone without her permission. I don't believe that she gave permission for the whole entire hospital staff to get her, the whole hospital staff that's been on the email to get her medical information. She did consent for the provider and the medical staff that is helping her at the time for her OR, for her scheduling for her OR for her surgery in order to go into her chart, meaning in order um, to make appointments, to discuss her medical record, to discuss what the plan of treatment is going to be, to discuss how long she's going to be out for, to discuss what kind of medication she's going to be taking, and how to further help herself. Yes, those people that are involved have the clearance to go into her chart, have the clearance to go through her medical information to diagnose her, to help her with what she needs to, what needs to get done. For the remaining of the people that are on the email do not have any obligation to be on the HIPAA on her email in order to know what is going on with her. The things that have been violated are, first of all, her social security number, which is extremely important. Her social security number, if it's found by someone that can use it for anything that they want, they can take her identity. They can steal her identity. Theft is extremely high, even in medical field. Her date of birth, her address, the illnesses that she has, the medications that she's taking, the appointments that she has, her psychiatry appointments, the notes that have been given on the psychiatry, everything that has been under the protection of the HIPAA law has been violated. HIPAA basically stands for the rights for the health of information, which was created on August 21st of 1996. It protects her from other people that do not need to be in her medical record. Even though it is a mistake that the medical record has been shared through email, that there are other ways in order for the provider or the nurse or the scheduling staff in order to communicate with the plaintiff. Some of the ways that they could communicate is by telephone call, which still needs to provide her three identifiers to make sure that they have the right person so the HIPAA violation will not be violated, which are date of birth, her full name, address, or date of birth, full name, social security number, or if she knows her medical record number. Um, Other ways that they can give medical information is by sending a letter just stating that she needs to return a phone call or come to the clinic in order to speak with someone that knows her medical information. Third is by emails, but is not by a general email that is not cryptic. If you send information that's not cryptic to general email, it is a chance for someone to accidentally send it through the whole staff. When someone's sending message for a memo, usually a lot of people are attached to that memo. And if they don't go by seeing exactly who they're sending it to, they could accidentally send it to a whole lot of people that don't need to be into her chart. In other ways that I have said, besides the three identifiers by phone call, three identifiers when she's in front with including an ID, and also identifiers when you're sending a mail is by My Chart. My Chart is a electronically set up web page where she can go in and get her medical information, where she can speak with her providers through via email that is crypted, meaning that no one else can go into her medical chart without her login and password. If she gives those information out to anyone else, that is her decision. But when sending information from from a provider to a patient, when those steps are taken, the risk of HIPAA violation being violated becomes minimal. Sending information through my chart helps the patient in order to get updated information, don't have to worry about anyone else seeing her information that's not supposed to be seen. She can send directly information to her and the provider, the person that was supposed to do the OR surgery, or the person that is supposed to schedule the appointment. Once the HIPAA violation was breached, there should be consequences that follow behind that, meaning finding out how, why, when, where, all those that needs to be addressed. And also the patient should be have like a conversation between her, the provider, and the supervisor. Even though the supervisor was not aware at the time that this had happened, there should be a meeting between all three, that they could speak with her and give a concise reason on why. So I believe that her HIPAA was extremely violated, and that there should be a penalty on towards the Ashford Hospital so that this cannot happen again. Thank you.